Hello, thank you so much for inviting me to join you in this Pan-African Symposium on Violence Prevention. My name is Greta Massetti, and I am a branch chief and senior epidemiologist in the Division of Violence Prevention at the U.S. Centers for Disease Control and Prevention. And I'm really glad to be participating in this session on research and evidence generation for action in violence prevention. I'm going to tell you a little bit about the work that we do here at CDC, focused on data to action, and I'm going to share my screen here to support countries in generating the best available data and using those data to inform evidence-based action to prevent violence against children and youth. As many of you know, violence against children and youth is a global public health and human rights crisis. About 1 billion children in the world experience violence every year. That's about half the children in the world who experience sexual, emotional, or physical violence annually. We also know that violence causes not only immediate impacts in terms of injuries, but also creates ripple effects that reverberate through a child's life. Children who experience violence are more likely to have mental health problems, including suicide, depression, and anxiety. They're more likely to have maternal and child health problems, such as pregnancy complications and unintended pregnancies. They have fewer life opportunities. They're at increased risk for engaging in risk behaviors like smoking and alcohol and drug. And they're, of course, at increased risk for serious disease outcomes, including cancer, HIV, diabetes, and others. But violence is not inevitable. It is preventable. We can recognize it and support children in leading violence-free lives if we can protect them, their families, and communities. At CDC, we do that by supporting countries in using high-quality data. Our model uses the Violence Against Children and Youth surveys, which are nationally representative surveys of all forms of violence, their risk factors, and context. We also support countries in using those data to engage in a robust data to action process to interpret, synthesize those data, and apply them to use Inspire as a technical package to inform evidence-based action. We've been working with countries since 2007 and now have been in more than 27 countries around the world. As you can see, many of them are in sub-Saharan Africa, which is really a global leader. This region is a global leader in having the best quality data available to prevent violence. We also use a data to action process to provide essential linkages between the VACs and the Inspire technical package, which is really based and reflects the best available evidence on what works to prevent violence. Inspire is based on several core principles, including using data to inform action, such as the Violence Against Children and Youth survey data, leveraging the best available evidence so that we can be confident that what we're doing is effective at preventing violence, and moving from response to prevention so that we're not only providing essential supportive services to victims, but that we are getting ahead of or upstream of the problem and preventing violence before it starts. I'm going to give you a few examples of countries that have used Violence Against Children and Youth survey data and leveraged the essential elements of Inspire to implement national action plans that are effective at protecting children. Eswatini was our very first country to complete a VAX back in 2007. They used their data to support safe environments interventions by providing training for domestic violence, child protection, and sexual offense unit police chiefs in police offices in all communities. They also established a database to track reported cases of violence. Eswatini also established mentoring programs for girls in schools to ensure that girls have access to safe and equitable education and supported education and life skills. There was also a scaling up of post-rape care into one-stop centers so that all victims of violence are able to get the supportive services they need in a wraparound context. And then also Eswatini focused on implementation and enforcement of laws by passing the Children's Protection and Welfare Bill and the Sexual Offenses and Domestic Violence Bill that created safe legal protections for young people and their family members. Tanzania's National Action Plan focused on safe environments by providing training for police on handling abuse cases safely and sensitively, and they established guidelines for gender desk and children's desks in police offices. Tanzania also focused on education and life skills and safe educational environments by creating child protection guidelines that were established and disseminated to every school across the country, and a code of conduct and ethics for teachers that required training every year for every teacher across the country to ensure that they had the skills to promote safe and equitable education for all children and students. Tanzania also established one-stop centers for post-rape care to ensure services for victims. I'm going to tell you a little bit more about some work that we also did in collaboration with World Vision, the World Health Organization, Futures Without Violence, and TPO Uganda that really focused on implementing a pilot project in Uganda. In Uganda, one of the key findings was that not only was that there were high levels of violence in the country, but also that there were high endorsement of norms that were supportive of violence. So we really wanted to target that issue and that data point. And we did that by using a program called Coaching Boys into Men, which is an effective intervention. It's one of the Inspire interventions that has been implemented in many countries around the world. The reason that Coaching Boys to Men is so effective is that it targets the social norms that often young men have that are supportive of violence by using trusted messengers. So who do young boys trust the most? Well, they trust their mentors, their leaders, their coaches, and in particular, their sports coaches. So we trained sports coaches to engage their athletes in conversations about respectful relationships and using nonviolent means to resolve conflict. And you can see there's a picture of one of our coaches and the young men who participated in the program. And this intervention really leverages those relationships that boys have with their coaches. We also conducted an evaluation, or this really World Vision led on this evaluation that showed what we wanted to know was if we surveyed the boys who participated in this program, what were they telling us before they started the program and after they told us after the end of the program? And we found that there was a significant increase in the proportion of athletes who said that violence was not acceptable in any condition. They increased from 42% to 85%. We also saw an increase in the percent of athletes who said they were intending to intervene if they saw violence happening in their communities, from 19% to 88%. We also saw that boys said that they thought that boys and girls should have equal rights, and that increased from 55% to 85%. And these are really powerful findings and really important in telling us that those boys who participated in this intervention really benefited from these conversations with their coaches. But we also wanted to go beyond that and ask, well, what about the girls in their communities? Are they seeing that their peers' behavior is changing as a result of these interventions? Now, remember, the girls did not participate in the intervention. The Coaching Boys into Men was for boys clubs only. But what we found was that there was a doubling in the percent of girls who said that they feel their school is a safe place, from 44% to 89%. We also saw a significant increase in the percent of girls who said that their community was a safe place, from 31 to 51%, and a decrease in the percent of girls who have experienced sexual violence or harassment in the last 12 months, from 95% to 71%. So we know we still have a ways to go here, but there's really promising data on how a very easily implemented low-cost intervention can have really measurable impacts on both the boys who participated in it and the girls, and in changing those norms that are supportive of violence. I'm also going to share some data from Kenya and what we've done, some work that they've done to look at violence over 10 years. So Kenya was one of the very first countries to implement a survey. Their first survey was implemented in 2010. They then repeated a violence against children and youth survey in 2019 and allowed us to see, did what they do based on the data they had in 2010, did that have an impact? And you can see females are on the left, males are on the right. The blue bars are the 2010 data, the orange bars are the 2019 data, and you can see significant reductions in lifetime violence for both males and females in every form of violence. When we also look specifically at violence against children, because the previous slide was children and youth up to age 24. When you look just at violence against children, we're seeing significant reductions as well. So Kenya really demonstrated leadership in advancing violence prevention. They did that between 2010 and 2019 by leveraging a multi-sector response focused on the stakeholders that needed to be represented in preventing violence and providing supportive care. They then used the data from 2019 to say, we've made progress, but what more can we do? And they updated their national response plan and focused on several core areas: laws and policies, family supports, education and life skills, community norms and values, response and support services, and coordination. It really used their 2010 response plan and built on it to propose additional investments and commitments. And really, ultimately, this multi-sector approach that leverages data and the best available evidence is about preventing violence, but it also needs to represent all of the perspective that the stakeholders care about. We know that violence against children has extensive and costly impacts on public health and development. When we can use effective interventions in combination as a package, it increases the benefits and reduces the costs of violence. And putting these components together works towards advancing national commitments and the Sustainable Development Goals. So I think that is about my time, and I want to thank you so much for giving me the opportunity to speak with you all, and for joining you virtually. I'm sorry that I could not be there in person today, but I really wish you all a wonderful rest of your sessions. Thank you so much.